Okay, everyone. I think we will we'll begin. So welcome and thanks for coming to this seminar. This is being simultaneously webcast, so I'll have to stay around this area, and then when we have questions at the end, hopefully please use the microphones on either side here. Welcome, and this is going to be the first of approximately 8 school-wide seminars that we'll have this year on humanitarian health, and we're planning them all now, and it's quite exciting because the goal for here is to try to be speaking about more the up-and-coming, or at least the controversial topics that occurring in humanitarian health. So the first one I'm going to kick off is a Lancet paper that we published this year, and it's really talking about the humanitarian system and how overwhelmed the humanitarian system is right now and how it was really set and established for a different time. So let me see if this will work. It will. So just some background. I think many of you know this from some previous classes and just through the papers. Unfortunately, even just in the last month with the Rohingya crossing over, we're beyond 65.6 million, which is very sad. But currently we have a tremendous amount of displaced populations, 65.6 approximately, higher now, which is one of the largest in nearly a generation. And you can see the breakdown. I think it's really important to note a couple issues. Number one is that the largest group are internally displaced persons, people that have not crossed a border, not refugees, and this has been consistent for a long period of time. We have then refugees, and within the international system, I think it's important to note that there are 2 different organizations responsible. There's UNHCR responsible for refugees, but then there's a special organization, UNRWA, the UN Relief Work Agency for Palestinian refugees, and that's for historical context. So when you add those 2 up, you get approximately 22.5 million. What's interesting when you look at some of these numbers, 10.3 million newly displaced. This was in 2016, and as we mentioned, there's now just recently, this doesn't include the 400,000 or so, at least Rohingya, which is a catastrophe. We're also not mentioning here the approximately 10 million stateless people. They can be displaced, non-displaced. In fact, the Rohingya, many of them are considered stateless because no country recognizes their origin. Myanmar doesn't recognize them despite them living there for generations, nor does Bangladesh recognize them as citizens. So they're stateless, which adds a whole new complexity. So where are refugees coming from and going to? This has changed. You know, for many years we had the Somalia, Afghanistan were the classics, and then Sudan, which then eventually became South Sudan. But if you look right now, Syria, which is now in its 6th year, sadly, is now number 1 by a long shot, 5.5 million. Afghanistan has been protracted for decades and decades. Mostly the Afghan refugees are in Pakistan and Iran. And now, sadly, South Sudan, which is a new state, and we have seen a huge increase unfortunately, in movement in South Sudan. And even since January, there's been over 1 million refugees leaving South Sudan. And Uganda now, in a camp called Bidi Bidi in Uganda, is now becoming one of the largest camps in the world. So years ago, the numbers were relatively stagnant, and in the last 5-10 years now, it's just actually increased, and the instability on top of the protractedness is making this very, very difficult for the humanitarian community to deal with. So also now, where are they going? And you'll see here Turkey. And what's interesting, though, is because of the Syria situation, Turkey was not a refugee hosting country previously, or very, very few refugees. Now it's it's the largest. So you've got Turkey, which are Syrian refugees, Pakistan, Afghan refugees, Lebanon, as well as Jordan, huge amount of Syrian refugees. So when you break this down and you look, you have Syrian refugees in Turkey and Lebanon, you have Afghan refugees in Pakistan and Iran, and then you have a mixture in Uganda and Ethiopia of huge amount of South Sudanese and Somalis. And again, there are a tremendous amount of countries producing refugees, but certain countries you will see keep on coming back and back. And this is another reason why the system isn't really functioning, because you have these chronic crises and you have these refugees staying for decades and even generations in these areas. So IDPs, not surprising, but again, when you look at some of the protractedness, so Syria and Colombia are the two largest countries that have internally displaced persons. Again, for everyone, just to be clear, people that have not crossed an internationally recognized border. But then when you look at DRC, the Democratic Republic of Congo, and Sudan are a lot of the, obviously Sudanese in the Darfur area, these are very, very protracted situations. And therefore how we respond, and that's what I'm going to be talking about, how we respond to these situations has to change. Just the classic putting refugees or IDPs in camps and then just giving food and health care in parallel ways is not working, hasn't worked, but is no longer even possible to continue to do with the amount of money that's available. So now let's look at some of the funding. And it is interesting, and you'll forgive me, my eyes, so I have to keep on looking here. But we have in 2012, 16 billion that was requested, that was actually provided for funding. And this is UN appeals, non-UN appeals, including IFRC, the Federation of the Red Cross, Red Crescent, and ICRC. And it's gone up to now 27 billion in 2016. So a huge increase. Yet, when you look in 2016, the amount requested and the amount funded, there was a 40% shortfall, which is one of the largest shortfalls, the biggest shortfalls that has ever occurred. So despite a massive increase in the amount of funding available, the shortfall is actually increasing. And there are numerous reasons for that. Obviously numbers, but also really importantly is that, you know, when you compare an IDP in Darfur or a refugee in Chad compared to, which would be the Sudanese, compared to a Syrian refugee in Jordan or Lebanon or Turkey, the amount of money from middle-income countries per refugee is significantly higher. And therefore, it's not just the number, the actual magnitude of people crossing the borders or at least being displaced, but it's where this is occurring. And this is another major challenge. And again, our system was not really built for this. Looking at the recipient countries, and this, by the way, if you haven't seen this, the Global Humanitarian Assistance Report, it comes out every year, and it's becoming even, every year it's improving, looking at government funding, private sector funding. It's really a wealth of information, and we use this a lot. But in 2015, the recipient countries, Syria, Yemen, again, Yemen is relatively new. This wasn't on our radar a couple years back. And then Jordan, South Sudan, and Iraq. And the top 10 receiving countries receive over 60% of the aid, which shows how much the aid is actually, how much of the aid is in a relatively few amount of countries. U.S. continues to give the largest amount overall, but per capita, the U.S. is not the largest donor, and that is Germany and the U.K. And they're the two countries that, at least that I'm aware of currently, that are meeting the overall 0.7% of GDP for overall assistance development that also includes humanitarian. What's new here, though, is so the US, UK, Germany, EU, Sweden, Japan. What's new here is Turkey. And Turkey, unlike, let's say, Jordan and Lebanon, Turkey, and another country that has done this as well as Iran, has actually welcomed refugees and footed the bill. This number is debatable whether it's so high. Here we're talking $6 billion. But whatever that number is, it's important that to note clearly that Turkey is actually a country that has decided that they're not going to be, they still are receiving money from the EU particularly, as well as other donor countries, but they have made a decision to spend a tremendous amount of money, and they've built camps, and they also have many refugees outside of camps. The other thing I wanted to mention that I didn't say here, let's see if I have, yes, is what you don't see here is the inequity between countries. So you have some countries, sadly it's often in Africa and often the Francophone countries, so even there's a 40% shortfall, you see some countries that are actually getting 10, 12% of what they request, and other countries that are getting significantly more, 60, 75%. And primarily, that is not due to need, it's due to, which one can understand to a degree, is due to political interests of the countries. And therefore, the Middle East is receiving, not disproportionate, it's still not receiving enough compared to what is being asked, but unfortunately, they are receiving the governments, for political reasons primarily, are putting, US and the EU are putting a lot more money there than they are to some of the more forgotten crises, particularly in Africa and particularly in the Francophone countries. So the inequity between the amount of the UN appeals and the amount of money where it goes is staggering, and the prioritization is not done according to need. It's primarily political in nature. So now, that's the setting. Now let's look at some of the norms and the current trends. I have here the humanitarian norm was and still is, and the reason is that things are changing, but they're also still in many situations remaining the same. Meaning, in many we prioritized and we've set all of our protocols. The way we respond is primarily in low-income countries, in sub-Saharan Africa. Frankly, even before that, it started in Biafra and then in the whole Thai-Cambodian border. But the point is, the way we respond primarily is based on low-income countries, and the last 2 decades it's been sub-Saharan Africa. Now, that's still happening, of course, but as I mentioned, we are seeing more and more middle-income countries. You know, it started in the Balkans, and then Kosovo, then Iraq, and now Syria. And it is very complicated, and I'll explain why, and I'm sure many of you know it's really complicated to respond in those areas compared to some of the lower-income countries, and more costly. I should even remove refugee camps, but it's camps. So in the past, we were, whether it be refugees or IDPs, our response was primarily in camps. And why is that? For lots of reasons. Number one is it's easy. It's much easier to respond in a circumscribed camp where you can just, you have people sometimes are not even able to leave the camp. But also, it's not usually the UN that will decide, or the NGOs, of course, where refugees or IDPs will be located. It's primarily the government, the hosting government, or the hosting government or the hosting population. And security is the big issue. So, for example, and I've mentioned this before, but UNHCR, the WHO, the ministry that WHO works with is the Ministry of Health, of course. UNHCR, the ministry that we work with, that the UNHCR works with most commonly, is the Ministry of the Interior. And so it's security that is first and foremost for many of these hosting governments. And that's actually become even more complex than it was decades ago because of the terrorism that we're experiencing right now that is relatively unique in its scope. So most of the situations and how we respond are in camps. And that still is the case because when you look around, you still see many, many, many camps. In Uganda, there's settlements, and we'll talk about how they can be changed, these camps or settlements, to be more welcoming and more village-like. But often camps also get the most media attention. So, for example, in Jordan, Zatri and then Azraq are the 2 camps. But the large majority of the population are outside of those camps. But they're hidden. And so I remember when we first started to respond in Jordan, all of the attention went to Zatri, which was the first camp. And you had at one point 6 field hospitals from different countries being put in, mostly There was a need, but you didn't need 6. But that's where you could clearly, all the media came, all the politicians came. And again, not an efficient way of using resources. What also has happened, and it's still occurring, but it's changing, are weak governments and few functioning national NGOs, non-governmental organizations. So in the past, you'd have an international community that would come in, generally ignore the population itself, but would also ignore existing governments, existing structures. They were considered either too weak or too corrupt or not in the areas in these more remote areas where refugees or IDPs were. And so in the past, it was autonomy of a country. Nationality, sovereignty was really not sufficiently respected. That's changing, and I think that's a very positive way that it's changing. When you look at, a lot of it is in the middle-income countries, Jordan, Turkey, but in the past with Timor, East and West Timor, you had Indonesia, strong governments, and therefore the way we work as an international community has to change. But that's not easily done either, because although we can talk about humanity and we all want to do good, and I think that is the case, there is a humanitarian business, and there is self-interest, both within the UN, within the NGOs, as well as countries, to make sure that you are seen, to make sure that you're doing something, that the media is there, to bring in more money. And we'll discuss this shortly. And then the last major issue, I would say, is communicable diseases. They're still important, but in the past, we would concentrate primarily in sub-Saharan Africa on communicable diseases. And the deaths, when you look, what were the major deaths in most of these camps? Diarrhea, malaria, acute respiratory tract infections, amongst others. That's changing, both because the protracted nature of these camps, non-communicable diseases, of course, are becoming more and more important. They always were, but we primarily ignored them. And then also we're dealing with middle-income countries where the demographics of the population and the epidemiology of the diseases are quite different. So some of the current trends, and this is another document I'd recommend by ODI, the Overseas Development Institute, and the policy group in London, is Time to Let Go. And why it's such a nice document is because, number one, it goes through the history of humanitarian response, and much of this relates to colonial times, of course. And so it talks about the history and then gives numerous examples of where we need to change. So looking at conflicts. Look at the difference between conflicts in 1990, on average, was 19 years, and now a conflict is lasting 37 years. The prolonged nature is changing things. And this example is looking at, humanitarian appeals are these UN humanitarian appeals that come out every year, but it's only for countries that are having humanitarian emergencies. Over 90% have had appeals for greater than 3 years, which again just means these crises are going on and on. There's a number of estimates about how long a refugee is a refugee, and it varies, but I think the latest that I'm most comfortable with is 10.3 years, maybe 17 years, but the point is it's a long time, and how we respond is on a yearly basis, and we plan yearly. Humanitarian funding is for 1 year, and we don't think or plan long term. And the host governments also don't want us to do that. Understandably, they don't necessarily want these people here for decades, so they don't even allow at times some of the longer term planning. And we need to work with them to explain that unfortunately this is the way it is, and that we can plan short term, but it's actually financially less efficient to be able to do that. If you can put in more into infrastructure that's more sustainable at the beginning, it actually will be cheaper in the long term. The other big interest, this is the self-interest a bit that we spoke of, but there's a reason for this. So the UN agencies and the larger INGOs, international NGOs, are the ones that are receiving the bulk of the money. So 81% in 2016, and it's supposed to change, and we can talk about that. But the local and the national NGOs are directly receiving, this was in 2014, I apologize, 0.2%, which is nothing. In reality, they are receiving more because what happens is the UN and the international NGOs receive their funds, they take a cut, and then they give to the local or the national NGOs. So they are receiving more than 0.2%, but they're not receiving it directly from governments, which is very, very inefficient. In May 2016 in Istanbul at the World Humanitarian Summit, there was a declaration, an agreement that by 2020, approximately 20% of the funding should go to governments directly and national NGOs directly. Let's see if that's going to happen, because that would mean very big changes for international NGOs and UN agencies, and it's not necessarily in their self-interest to do that. And then the last part that I think is quite interesting as well, in terms of current trends, and if you look at this graph here, you will see the number of people responding, the number of organizations responding is increasing by a huge amount. And that makes coordination extremely difficult. And we'll talk about coordination. But we're also seeing different actors. So we're seeing privatization. We're seeing, firstly, many Islamic actors, and I think the national Islamic organizations. We're seeing a lot of private actors. I was just back from Iraq last week, and in some situations, a private organization from Australia was hired to actually develop and implement a field hospital. That's not necessarily a bad thing. Maybe they can do it better, more efficiently, but there are also the classic humanitarian principles that need to be looked at and discussed. And this is still a big issue, and this came up and will continue to come up in Iraq and in Syria, amongst other places. So Syria, and I would say that I'm going to show you some pictures that are iconic and horrific pictures, but I would say a lot of the changes now that many people are proposing is really due to Syria and what's happened in Syria, even though, and there's a couple reasons for that, and I'll explain why, but just to show you a couple iconic photos that still blow your mind, but also, you know, when you see these, when we all see these, we hang our head in shame and can't believe 6 years down the road, this is still happening and that there is no resolution in sight. And the Syria situation didn't just affect Syria and didn't affect just the regional level between Shia and Sunni. It affected Europe, it affected populism, it's affecting so much of politics right now that was, I would say, very likely unexpected that this happened. So the effects of Syria are horrific for the Syrians, obviously, horrific for the surrounding countries, but the knock-on effects that we're seeing, and particularly the knock-on effects of politics and the populism that we're seeing, is a part of this broader issue of the migration that has occurred into Europe and other areas. So now some of the recommendations. I'm just going to check my time. Good. My goal is to speak for another 15 minutes or so, 15, 20 minutes max, and then I really would like to open it up for questions and comments. So we put it down into four. It was hard because there could be many more, but I'm going to go through each of these to talk about where at least I believe things need to change. And it's going to be talking about the centrality of protection, and I'll explain what that is, although it's not easy to put into words. Humanitarian development nexus, leadership and coordination, and making the interventions more efficient, effective, and sustainable. So centrality of protection, and this is all protection actors, ICRC, UNHCR, will use this term. And it's very important, but it's actually not so easy to explain. But what we're trying to say here is that in conflict settings and even non-conflict, humanitarian settings, protection is at the core of what we do, whether it be through dignity, whether it be providing shelter, but we are protecting people that have displaced or not displaced. And I apologize that I didn't say this at the beginning, but we don't even have a very good number in terms of non-displaced people that are affected by humanitarian emergencies. But it's likely significantly higher than 65 million when you think of Srebrenica, Aleppo, Raqqa, all of these areas. There are a tremendous amount of people affected by emergencies that have never actually even been, are not displaced, and we don't necessarily respond very well to them. So the idea is that centrality of protection needs to be at everything we do. But what we have found in the past, and some of you are familiar with the protection cluster, which is one cluster that actually deals specifically with protection, is that they're often discussing humanitarian laws, resolutions, which don't necessarily translate into the field. So one of the recommendations is to really start looking at more community-based protection, not having lawyers in the field saying we should be doing this or you should be doing that, but rather people, often from the affected populations, but internationals are very important here because having an international may allow for more witnessing and advocacy than having local populations that may be suppressed by people around them. So the idea is to have community-based protection, which means many more people in the field working with the communities. But it's also meant, and particularly for some of the public health response, is for us to be a little bit more sensitive to, it's called protection sensitive. As an example, they're really simple things, but it's still occurring, and we're still making the same mistakes, unfortunately. A year and a half or so ago, there was a big exodus from Burundi. And they went at the beginning into Tanzania, but on a small island, and it was just incredible to see all these people. But we dug latrines and we did our usual stuff, but unfortunately there were simple things. The lighting was still not sufficient, so that particularly around the latrines or just public lighting was insufficient. We didn't have simple indoor locks on the latrines. We're not sensitive enough to sexual gender-based violence and how we can actually address these issues from a health perspective. We don't have sufficient female healthcare workers in these areas, and it's a constant problem. So we as public health professionals need to be aware of protection-sensitive interventions, but conversely, the protection people need to be a little bit better at not saying, it was very common you'd hear in UNHCR and IRC, you need to be protection sensitive, or centrality of protection is everything, but it was hard to actually get them to help us translate that into actions. So that is one recommendation. The other big recommendation is we've seen right now, and Len Rubenstein here at the school is leading a coalition on the attacks on healthcare workers and health facilities. But what we're seeing now is unprecedented, particularly in Syria and in Yemen. Years ago, when many of us first started, the Red Cross, the Red Crescent was sacrosanct, and you'd put it on the top of your car in your hospital tents, and it would be clear no one would attack. Now it's almost the opposite in some ways, and so we're seeing a huge amount of our colleagues being attacked and getting killed, getting kidnapped. And it's for various reasons, of course. It's for making sure that the population doesn't have sufficient health care, and therefore they're going to be, hopefully, the people that are doing this want them moved out of these areas. It's when you attack healthcare workers, when you kidnap healthcare workers, or any humanitarian workers, often people leave the scene, and therefore the people that are fighting can do horrific things without being witnessed. But it's never been like this. And so in May of last year, the General Assembly did pass a resolution to say that this cannot continue, and without impunity. The impunity cannot continue. But what we're seeing consistently still is this is occurring. I mean, it's incredible what we're seeing in Syria, where many of the Syrians have had to put their, not even clinics, you wouldn't call them, but just a simple operating table underground somewhere in order to be protected from the bombs. And in Yemen, it's happening with the Saudis. So a resolution has occurred, but it has had no effect whatsoever. In fact, it's gotten worse, and this is another report that was put out looking at the impunity that is still occurring on the attacks in the conflict zones. So is the Security Council and the General Assembly not actually, why is this continuing? It's again, and everything will relate to politics and either at the global level or at the regional level, but you're not going to get Russia, China, and the U.S. And the other Security Council members to agree on next steps when you have different sides fighting in Iran as well. When you have these different sides fighting, you're not going to be getting resolutions that will have any teeth. So one way to try to deal with this is to actually have an automatic response when a act occurs, number one. That's difficult, again, because the power countries may not agree to this. But more and more, when you have resolutions and you have no response from a resolution, we're just seeing the impotence, I would say, of particularly of the Security Council, but of the General Assembly as well within the UN, where you're coming up with resolutions and it's having no effect. And so we need to try to change this, but frankly, it's not very easy to change. And the last recommendation in terms of protection comes with the most recent Ebola outbreak, and then Zika was a little bit less so. And it even started years ago with HIV. There is almost an impulse to try to quarantine when you have certain communicable diseases. But we need to really look at the effects of a quarantine. As we saw in Ebola and as we saw early on in HIV with travel restrictions, it doesn't work. And for the most time, people just go underground. And so it's actually it possibly could be spread even wider. And we need to be able to work with governments, and WHO as well as UNAIDS has tried to deal with this. But the impulse to immediately put a quarantine on with large communicable disease outbreaks, particularly when there is a big stigma, of which most of the time there is not a good public health measure, and this is something that we need to continue to work on. Now, the Humanitarian Development Nexus is not new. Gilbert Burnham was talking about this when I was his student 20 years ago. It may have been called the Humanitarian Development Gap, the Humanitarian Development Divide, but it still exists. The difference, though, now is that particularly the World Bank is looking, but other multilaterals are looking at this. This became a really big issue, again, because of Lebanon. When you had 1 in 4, 1 in 3 people in Lebanon actually a Syrian refugee, it was impossible. It was very clear that the development of Lebanon would be affected, and you just can't have your development plans when you have so many refugees like that. And you can't look at the humanitarian response and it should be focused just on refugees, and then you have your development response with different goals, longer term outcomes for the Lebanese. It didn't make sense. And it has never really made sense, but I think this just brought it to the fore. So what is happening now is a couple of things. Number one is when there is a displacement, what we're proposing is to try to look at the development plans of the area where it is displaced. And probably the key to this is going to be livelihoods of refugees or internally displaced persons. Because right now what happens is, particularly refugees that are not nationals of that host country, an overwhelming amount cannot work. They are not able to work. And therefore, if you can't work, you can't pay for services. And if you're put into camps and you're given international aid for the rest of your life, it's just not sustainable. You become dependent, your motivation, you become emasculated, and that's what's happened. For many generations, we've just been warehousing refugees. So the World Bank has taken a lead, and they've done a couple really interesting studies and then responses. Number one is they've actually looked at where refugees in Jordan, in Lebanon, in Uganda, as well as Kenya, and they've looked at the economies, and they've actually found locally economies have actually improved where you have refugees located. Why is that? One, refugees are themselves have a lot of skills. Number two is you have international communities coming in, providing a lot of funding. But amongst the national population, or the host population, it's not equal. And so you have obviously the businessmen who are receiving and doing quite well, but you have the laborers that are not doing as well, because as you can imagine, you have your refugees not allowed to work, but they still are going to work somehow underground, and they're going to do it for cheaper. So the bank is working with a bunch of different countries, and they're trying to look at the needs of that, at least at the local level, the needs of that. The needs of in different disciplines. They're looking at the refugee skills. They're looking at the host country skills, and they're trying to put in trainings that will actually make sense. In the past for refugees, our trainings were hairdressers and mechanics and areas, because we were just trying to teach them skills, but it was probably more for their mental health than actually economic improvement. So the bank is working on that. The other thing that the bank is doing is, for the first time, there's a $2 billion concessional loans to refugee hosting countries of greater than or equal to 25,000 refugees. So for the first time, the bank is saying, if you come up with a plan for refugees and nationals to work together, we meaning the bank, will actually give you funding, and it's directly to the government. It's not through the UN or international NGOs, and they have to just work to try. The plan has to benefit both nationals and refugees. This is pretty revolutionary for those of you that have been following this, because it's never occurred before. Similarly, when the EU gave Turkey $3 billion and is in the midst of doing that, and that's quite controversial because they're stopping people from coming over. But despite that huge limitation, they negotiated with Turkey and they negotiated with Jordan to say, you have to let a certain amount of workers, actually refugees, be able to work. And they also developed some free trade zones, so that both in Jordan and in Turkey, certain goods that will be made by refugees and nationals will have reduced tariffs when going to the EU. So this sort of thing is hugely important, and it really has not been done in the past. Whether this will actually make a difference and can go to scale remains to be seen. It's extremely hard in Jordan when you have 60% of your young men who are unemployed. It's not easy politically to be able to move forward on this. So how this will work in the future, we'll see. The other area that I wanted to mention is integrating international systems and avoiding parallel health services. So in the past, we would set up camps. We're trying to say, let's not set up camps if security allows and the government will allow that. But regardless, even if you set up camps, don't make them like a camp, make them like a settlement, figure out where the markets are for the nationals and the refugees. Look at where the schools are, look at where the health clinics and the district hospital is, and build that up, so that the point is to try, and it's not easy, but to try to make it a win-win situation for the nationals and the refugees. And if you can, for example, if you can provide more ambulances, improve the district hospital, if you can improve the national, the primary health care system, but put it outside of the camp, that should make a big difference. It's not going to be possible everywhere. In some of these areas, the national healthcare system is hardly functioning, and therefore that probably will not be doable. But that can still be a long-term plan, because, as we said, refugees are going to be there, or IDPs, for a long period of time. And the other big issue will be, and we've seen this, is that when you do this, refugees or IDPs, at the beginning at least, will not be paying for services. In an emergency, you don't ask these populations who have no money to pay, but that disrupts a national healthcare system where the locals have to pay. One, they're often revolving funds, so then suddenly you will see that they may be getting less funding, the government system. But number two, the animosity that can occur between refugees and host populations is very high. We see this in everywhere, basically, particularly when you focus just on that displaced population, but you're not focusing on the national populations. Which is to the last point here, and this has been difficult over time, but when you look, UNHCR, the High Commissioner for Refugees, their population are primarily refugees. UNICEF, the World Food Programme, WHO, they are not really, their population, their mandate is not for refugees, it's for overall vulnerable populations. And so we saw tensions in the past, and again it became more profound in Lebanon, where you had so many refugees, but you also had many Lebanese that were poor. Yes, they may have had better coping mechanisms because they had family and relatives, but you would see often UNHCR at one point and the donors saying this is money for refugees, and you would have UNICEF and WFP saying, well, we have money and we want to give it to the most vulnerable. UNHCR has always tried to make sure that the host population is included, but there are tensions, and so more and more I think there's agreement that generally refugees and IDPs will be more vulnerable, but these populations, these communities are just like any other community. You have wealthier people, you have less wealthy people, and so there's generally agreement now that we have to look at wherever these displaced persons are, we need to look at the whole environment, and we need to make sure that everyone who is vulnerable is getting care, and not just those that have been displaced when the non-displaced nationals may be at risk and in some cases even more needy. That's not easy because there we're mixing again this development and humanitarian response, and development is longer term money generally going to governments. Humanitarian is 1 year going to UN or international NGOs at present. And it's very hard. So there are different rules, there are different reporting requirements, which makes it more complex. Remaking leadership and coordination. Haiti is just one example of many of how you had a huge amount of people coming in, mom and pop organizations in Lebanon and Jordan, in Chad. You have so many people, organizations coming in that either don't necessarily have the skills, or you just have too many. And even if they all had the skills, there needs to be a way to make sure that it's done organizations are placed in an area where they are needed. And there is the cluster approach, which many of you know, and that's primarily for non-refugee situations. There's the refugee coordination model for refugee situations. But there have been numerous reforms of the humanitarian system because coordination is extremely difficult, but it's become far too cumbersome. And some would say with OCHA and perhaps even with UNHCR, who are coordinating for refugees, that the coordination becomes too heavy and there are too many meetings, too many processes, and we're not actually being on the ground and delivering. And I've certainly experienced that, where in the past we would really be in the field and our meetings would be in the field for coordination meetings. Now you have to have meetings at the capital level, simultaneous meetings. Now you have so many sectors or clusters, and it was meant to be that you would only prioritize those clusters of the greatest need. But in the end, most of these clusters are actually activated, whether it be shelter, nutrition, health, WASH, camp management. And the reason is every organization wants to be there. There is always need, but there's insufficient prioritization. And so we need to be the recommendation is that there needs to be fewer UN organizations and fewer international NGOs that actually are operational. And we've seen this, and it's, and I'll get to the World Health Organization in a second, but we have seen many UN agencies that are a part of this emergency response, but actually don't have the expertise in humanitarian emergencies, are not operational enough, aren't able to have the personnel policies in place. But because there's money and because there's media and because there's issues of power dynamics, nearly all the UN agencies now in the cluster approach are actually responding, and it doesn't make for the most efficient response. The World Health Organization has been going through a lot of changes over the last while, and I think we all know with Ebola, and at least at the beginning, how poor their response was. that they have undergone a huge reform, and I think the jury is still out whether the UN, the WHO can actually be operational. It was not meant, it wasn't set up for that. It's a very difficult Byzantine architecture. Most of the time, WHO in the field are based with the Ministry of Health. Therefore, there's an issue of neutrality. They're primarily technical and not operational. When I was at UNHCR for 14 years, I saw at least 3 major reforms of WHO to try to make them more operational. I'm more hopeful now than I've been for a long time. As I mentioned, I just came back from Mosul and Erbil, and I actually saw a WHO that was operational and was actually doing some really, really good stuff. But I haven't seen that in the past. And so we need to all follow WHO, I think support WHO, but follow them to make sure that that they are operational and that they are independent and that they need to speak out when when there is acute watery diarrhea, or rather when there's cholera in Ethiopia, we need to speak out and call it cholera, not acute watery diarrhea. When there's Ebola, we just need to be able to make sure that we can say there's Ebola and not worry about the effects of the government where that Ebola is occurring in terms of, and there are big issues there in terms of their economy, in terms of airline travel. So it's not an easy decision. But let's hope the WHO has learned that lesson. They have made significant reforms. I'm more hopeful now than I have been in the past. But we also can't wait forever. And so I think we need a couple more, 3, 4, 5 more years to make sure that WHO has changed. And if they haven't, we need to consider some other options. The last area that I want to talk about, and this is actually quite interesting, and I think Hopkins can have a major effect in this area, is looking at more efficient, effective, and sustainable interventions. I'll talk about cash shortly, but some of that I mentioned early on is the idea of upfront investment by donors. We've looked at some cost-effective interventions in WASH, particularly in WASH in refugee camp settings, and we've seen that because of the money is always limited. It's 1-year funding, and therefore you just compromise. As I mentioned, the leadership isn't there, and the data are not there to say we need to prioritize X, Y, and Z over A, B, and C. And that's not happening. And therefore, what happens is it's almost a compromise. Every sector or cluster asks for a certain amount of money, and then it's very hard in the field. It's very relationship bound. You don't want to upset other agencies or NGOs. And so often what you do is you compromise. And so everyone often will overinflate what they ask each sector because they know they'll never get what they want. And then there isn't a way to really prioritize according to evidence base. And so often it's just a compromise so that you ask for this and then you get 80% across the board. And WASH is just one of many examples of where we've seen piecemeal WASH approaches in terms of latrines, in terms of water systems, that actually in the long term, if you had put in substantially more money, particularly into camps, you would have saved millions of dollars later on. And we've seen this in Zatri refugee camp in Jordan specifically. The problem there is, as we said, a 40% shortfall. If somehow we could make up, and this is where some of the innovative health financing mechanisms may come in, but if we could make that up using some money from another source, and then maybe that source would get paid later, and I'll talk about that, maybe we could address some of these issues because the money up front may not be available, but if we can convince the governments and the donors that in fact putting this up will save you money, maybe there can be a way to get some of this. There's already talk about initiating multi-year funding, but frankly it's not easy, and we've seen this consistently. Firstly, we've seen, I think I mentioned this yesterday, but we've seen a lot of donors across the world say that they're going to give a certain amount at bidding conferences for Afghanistan, but half the time they don't actually give what they promise, and or they actually take away from somewhere else. So multi-year funding is difficult because, as we see in the current administration, we don't really know. We have no idea what the budget cycle is going to be. So it's very hard to actually do humanitarian multi-funding. But there is a push for this. And particularly if we're looking at some of these longer-term development issues, and unfortunately we've seen this where we start livelihoods programs for refugees or IDPs, but it takes years to develop this, and it's just not a year, 1 year or 2 years, and often that's the first thing that's to be cut. And so a lot of these longer-term development issues are not functioning well. Cash-based transfers is really important, and I think we will likely have in one of our seminars in the future, we'll likely have something on cash-based. We did this last year. It's really exciting for numerous different ways, and I have to give credit to DFID, the UK development agency, as well as ECHO, the Europeans, because they have been the ones that have really pushed cash-based interventions. And what is this? It basically is the push to get away from in-kind. In-kind is giving food, is giving tents, is giving shelter. Often you're bringing these from outside. As you know, in the past, the U.S. would have the surplus grains. This has changed now, but for many years, it would be U.S. surplus grains that had to be transported on U.S. ships. That did change a couple of years ago to the U.S.'s credit. But still, what's happening now is if you can give money to refugees, and more we call it either multi-purpose, or you can think of it as unconditional, but you're giving a certain sum to the most vulnerable populations, and then they spend it. What happens? Number one is we've seen it consistently. The dignity that this provides is extraordinary. So just from a mental health point of view, you're just not giving them a pulse, a grain and oil, but they're choosing. It's more efficient generally because what we've seen consistently is when you give them food, commodities, 3 commodities, they sell a bunch of it at a lower price, and then they buy what they want. This way they can buy, already they have cash. And it relates to this whole development component because they're spending this money locally, and therefore in theory they will be helping the local economy. There are a lot of buts right now, or there are a lot of we need to see. Number one is it's not a panacea, and I think a lot of people are pushing this as a panacea. It's going to change everything. I think it will have a major effect. You first, of course, have to do a decent market analysis. This is when you don't have an elastic economy, so it's going to work. It works, and we've seen, and we've done enough studies. It works well for commodities, and even when there isn't much of if there is an insufficient amount of a certain commodity, we've seen the elasticity of the markets and people coming in because there's money to be made. In terms of health and education, the jury is still out because you can have all the money you want, but if you don't have an infrastructure, a supply chain, if you don't have healthcare workers, it's not going to work. And so there isn't enough. And I would say our group, the Center for Humanitarian Health here, are working on these areas to try to look at how cash can actually affect health. Then when you have a catastrophic event, of course, in health, if you have something, a major hospitalization, a major cancer, this is not the answer because this is meant to be a monthly stipend to be able to move forward. It also will have a major effect on coordination, and we're seeing this. And for those of you who read either Relief Web or The Guardian has The Guardian has a special on the webpage on humanitarian issues. You see how this is changing and how the World Food Program and UNHCR, who have taken the lead in cash, there's a lot of competition between the two agencies. But the point is that coordination, when you're providing, you need expertise in terms of sectors, and so you see that UNICEF will deal with nutrition, WASH, and child education, or just education. But when you're giving cash, you may not need 10 UN agencies and 17 international NGOs. You maybe want to work directly with a bank, or you have one agency that can help deal with the the key with cash is really understanding who's most vulnerable, and it's changing a lot over time. So it is probably a game changer in many ways because we will need fewer people, fewer organizations to respond to cash, and we're giving the people much more choice and improving the local economy. But there's still a long way to go, and there are protection issues. we're dealing with banks now, and we're dealing with cellular companies. There are anti-terrorism laws, know your own customer, and so it's not going to be as easy and as efficient as everyone thinks. And the other thing that we've learned from WFP is it's not always cheaper to start up. One assumes that it's going to be cheaper, but actually the startup costs in some situations when you're dealing and you're making agreements with grocery stores or bringing in grocery stores into Zachary refugee camp, it's actually cheaper to have just given out some staple food, but it would not have had the same effect. My last major point is on health financing. We're looking at, actually, I guess there are two, but on health financing, it's clear right now that the model that we have of primarily Western governments giving money is insufficient. I mean, we have to give them credit because that's primarily where this money for humanitarian has been coming from. The vast majority are from Western governments, and probably from really it's from Europe, Japan, US, Canada, Australia. So I'm sure I'm missing a country here or there, but the point is that's where it's been coming from. It's insufficient now. We need to look for other, and we already are trying to look for other, up and coming countries, obviously China, Brazil, India, but that's slower coming, but it's also the same model of giving. And what we're trying to do, and we've been working a bit, again, the Center for Humanitarian Health has been working with the World Bank and some reinsurance companies, is to look at existing model in other sectors. So for example, there are something called catastrophe bonds and natural disasters that have been around for a while. And some of them were just paid out recently in the Caribbean. But that's where you have investors, whether they be philanthropists or private sector, you have bonds that they pay into, and then when they're called parametric indices, when something can be measured, such as a reduction in rainfall, a hurricane, increase in food prices, when they hit a certain level, agreed upon level, then money will be paid out. It's going to be much more complicated for conflict situations. What would these parametric indices that can be measured be? What is the risk for this? It's, we could be, the interest could be very, very high on these sort of loans. The other area that we're looking at is health insurance. And previously, when I was with UNHCR, we implemented health insurance for refugees in 10 different countries. And in Iran was our biggest success, where we started with a private company. The government allowed us to do this, but wouldn't allow us into the national system. And we had over 250,000 Afghan refugees having access to health insurance. And this was important and then eventually the Iranian government allowed the Afghan refugees to actually go into their national system. Iran has been incredibly generous with the Afghan refugees. And they did this also because UNHCR could only pay for a pittance. The refugees couldn't pay for everything, so that the government itself was paying for a huge amount of hospitalizations anyway. So they thought, if the refugees can pay for some, because they actually are allowed to work. They're not all of them, but many are allowed to work and get work permits. And then UNHCR paid for the most vulnerable, for those that could not. And this is something that we're looking into more and more in other countries to see how feasible this is. It's dependent on lots of things. It's dependent on refugees being able to work, because if they can't work, of course, they can't pay, and then it would just be UNHCR or others paying in another way. It's dependent on a functioning national system, but it should be beneficial to the national system, because if the risk pool is wide enough, then if all refugees have to pay regardless of whether they are sick or not, they pay into insurance, it should bring enough money to this insurance, the national system, to improve the national systems as well. So there are a lot of really interesting ways forward. The World Bank and WHO are just finishing it'll come to me what it's called. It's an epidemic. I'm blanking on the name right now, but it's an emergency epidemic fund, and it's a mixture of bonds and reinsurance companies. And what they have is certain diseases and then certain thresholds. And the idea here is that when an epidemic occurs, what we saw in Ebola is financially it took time for this money to come, and it just took way too long. So they want to fill the gap very quickly by this it's emergency pandemic fund. So it'll be quite interesting to see how this will shake out. We have it for natural disasters. We have it now for communicable diseases or epidemics. We don't have it yet for conflict settings, and I think there's a good possibility that we can move forward. I'm going to skip this and just say that we talk a lot about Syria, Yemen. We don't talk enough about South Sudan, Central African Republic, even less, and Burundi, which are, both of these two countries are so tenuous, so fragile, and close to a, I don't want to use the word genocide, but certainly ethnic cleansing, and what's happening in these two countries is extraordinary. Being in the U.S., moving from Geneva, you really see a difference in the Anglophone-Francophone divide, and it's really hard in the U.S., unless you watch France 24, to actually get any news on some of these Francophone countries. And this slide was before, I used this slide a couple months ago before the current situation started. So now we are seeing much more media attention, but we're still seeing a huge amount of we're not getting the funds even for the Rohingya right now, the Rohingya in Bangladesh, and this was meant to be in Myanmar. So with that, thank you, and I'm very happy to take questions. So if you have any questions or comments, please use the microphone because we are live on the web, and please don't be shy.
Hi, my name is Michelle Saleem. I had a question about the agreement between the EU and Turkey, and I was wondering if you could talk a little bit more about that and what, in your opinion, are the limitations and the benefits of such an agreement, and if it has set a precedent moving forward for future refugee conflicts. And then also a point of clarification on the slide where you had $6 billion from Turkey. Is that counting what the EU had given to them? And was it subtracted from the EU's contribution? Or I guess how was it calculated exactly?
Yeah.
Thank you.
Certainly. I'll start with that. With Turkey, no, that figure did not count. That's what Turkey, the country itself, says they have given towards the Syrian refugees in their country. The money is coming, though, into Turkey now. The EU-Turkey deal is very controversial. I would say from a refugee law, it's you are stopping people from moving forward, and more importantly, you have to look at each country. And Turkey has ratified the Refugee Convention, but they've only ratified it in terms of when it was first developed, which means it was actually after World War II, and so it's for European refugees. And so they actually have the right, any refugees that's in Turkey, to move onward. There's no, until this now discussion, there wasn't an agreement like they had in the EU, the Dublin Accord, where wherever you arrive in the EU, that first port of entry is where you have to be registered. So in many ways, it's quite unfortunate, and you see how any country that it's easy to talk about human rights and about migration law, but when you become overwhelmed, as what happened in Europe, in fact, I mean, it's very sad because that's when everyone in the world really started to take notice of what's happening in Syria, when it suddenly started to hit Europe, when it was already so bad, of course, beforehand. So this is a precedent. We all know that the Kenyan government, after this deal was struck with EU and Turkey, the Kenyan government announced once again that they were going to repatriate all of the Somalis in Dadaab refugee camp. Certainly, and they've never done it, but they've talked about this for a long period of time. And certainly in their mind and many other countries' mind is, well, I'm hosting hundreds of thousands of refugees. Why aren't I getting 3 billion or now 6 billion? So it's not a very good precedent. At all. And you had at the same time the UK saying, well, we won't take any refugee that has gone through EU countries, but we will resettle those that have still been in Jordan or Jordan specifically. So the idea was, unfortunately, that the European Union said, we have to figure out how to stop this flow, and Turkey had the spigot, and they could stop it whenever they wanted, but they needed to, they agreed on the money, and they also, but this hasn't happened yet, they've talked about visa-free travel from Turkey to the EU. So there was, as always, a tremendous amount of politics. Please.
Thank you. Yeah. We know this taking care of refugees is necessary in terms of humanitarian reason, but not all public accept, acknowledge this is necessary thing. So my question is, there are two questions. The first one is, how did the host countries until now appreciate the public? And the second thing, appreciate the public to accept, the refugees. And second thing is there any guidance UNHCR provides to the expected host countries regarding how to deal with the public response? Yeah.
And can you state your name?
My name is Hisu.
Nice to meet you. Yes, it's difficult, and what we've seen more and more, especially over time, is that the tension between refugees and the host population increases generally over time. It's not unusual, remember, in Cameroon, from the same ethnic group, relatives across the border. So they would take the people in, take their cousins in, but over time, when there's not insufficient funds, and refugees mostly go to relatively poor and under-resourced areas, so it becomes a problem. And you see over time, and you saw it in Jordan and Lebanon, the Syrians become, the local population starts resenting the Syrians or whichever refugee that is. You often see rents going up. They talk about increased crime, whether that's from refugees or other situations, but you certainly have a lot of density of populations. Services go down, schools increase. In Jordan, they had to start doubling up their schools and having twice a day. So it's not easy at all. I think part of it is it is an obligation by countries, those that have signed the convention, but in the Middle East, many have not signed the convention, yet they've been unbelievably welcoming and have intermittently stopped their borders, but they've accepted millions of refugees, where the EU accepted maybe 1 million and just were completely overwhelmed. So these countries have done incredibly well. It is very hard, though, we have public relations people. UNHCR and others work very closely with the governments. They give a lot of money. The money that UNHCR, some gives to governments, some is giving to NGOs. But this is the problem. I think that certainly with the Middle East, at the beginning, they called them guests. They wouldn't call them refugees because they wanted to avoid what happened with the Palestinians, that they came and then stayed forever and that there was no resolution. So it's a question that is very difficult. But finally, just to end by saying, I hope with this humanitarian development nexus, and more, if we can try to make our policies smarter so that we can ensure that the money that's coming for refugees or IDPs and the development money is used together to actually make sure that the host community's services improve, that should alleviate some of the concerns that are happening now.
First, thank you for the lecture. My question that we learned that for NGOs and other organizations, that it's more simple to support those people internally displaced than refugees. But do you find this practical? Because especially in the developing countries, the governments usually is a part of the crisis. So they thought that, or they think that those refugees or internally displaced people are enemies. So, and they think that the NGOs, UN and other NGOs, Red Cross, are supporting their enemies. So it might be more difficult, as an example, to support internally displaced Syrians as we see in one of the slides, the first photo, it was in the Yarmouk camp in April 2014, I guess. And it takes, I was there, it takes about 2 months to draw up a contract with the Syrian government and the oppositions that to help those people. In that time, about 13 of those refugees had been died because they didn't find food. And then finally, after 2 months, we talked to the Russian embassy in Damascus. And I remember that day, I told them that we are in 2014, and we can't find people that they died because they don't find food. Those people are not from another solar system. And we are on the earth, and people in 2014 can't find food and they die. After that, we saw this photo in that slide, and we were with UNRWA and UNHCR, Red Crescent, Red Cross, and we didn't expect that number. No. We thought that they are 4,000, but the number was huge, and most of those people, not most of them, too many of them had been arrested by the government after that. So by the next week, in that photo, nobody can go to that point, Red Cross point, to get food there because they prefer to die in the camp than go to that point and be arrested by the government forces. That's what happened there. So, but on the other hand, if you want to support refugees in Lebanon, it's more simple that to talk to the Lebanese government because it's not a part of that crisis in Syria or Jordan government or etc. Yeah. That's my point. And the second point, that about question last week, that about Iraqi refugee, it's a joke. It's Iraqi refugee that just moved from Mosul to Erbil, and so she is internally displaced. By next week, it might be a refugee because she will cross an international borders after this election in the Kurdish area in Iraq.
Absolutely. Yes, as always, the answer is it depends. It is easier, I would say generally it is easier to address refugees than internally displaced persons for everything that you said. Once a refugee has crossed a border, it's a host government, and generally that host government would like help. If they've signed the Refugee Convention, they're obligated to do so. So I would say generally it's easier to help refugees than IDPs, but on the other hand, you have certain IDPs that actually have been moved from an area where they're being repressed to an area where they're like the Kurds who are moving into Kurdish areas. So it was extremely easy in northern Iraq to actually help the Iraqi Kurds that had moved into the Kurdistan areas. Whereas it would not be easy if they are in Darfur, example, and you have the Sudanese government that doesn't allow that. So like everything else, it's very politically dependent and context dependent. Yes?
You just mentioned how humanitarian work has this political context. What with the recent rise of nationalism in these really powerful countries, do you see this as being more of a temporary challenge for humanitarian work to overcome, or more of how will it have long-term impacts on the changing humanitarian sector?
Yeah. I don't know. I mean, it's very, very concerning, obviously. When you look at, but I see it being longer term, meaning this is not just a trend in the U.S. or so, I mean, you even saw in the German election just last week, you have the ADF. So it is a big concern, and politicians will have to cater to that base as well, and therefore they're going to be making, I believe, they'll be making certain rules. I mean, we just saw now that this administration is I think it's now 40, they're saying that we can resettle, they want to resettle 45,000 only, which is one of the lowest. So I think that we're in for a long haul here. It's not something that will change very quickly. On the other hand, we really need to, and I don't think we've done this well, to understand why this has occurred. You know, if we just say, particularly in liberal institutions and academic institutions, this is bad, and we need to really understand why and not I'm not saying anyone hears, but not looking down and not saying this is crazy and must stop, but actually understand the causes of this. And it's extremely difficult to do, I would say, particularly because we often live in a bubble. But my feeling, but you would know as much as I do on this, my feeling is that this is going to be not just 4 years, but it's going to be a longer time, and it's certainly a liberal democracy issue across whether it be Australia, New Zealand, Canada, US, and Western Europe. So it has me, and I'm sure many others, very worried. Thank you. We'll do the last question.
Okay. First of all, thank you very much. Just a quick question about the goal of moving to 20% of the humanitarian funding by 2020 to go to local governments and small locally based NGOs. So you mentioned the barriers on the part of UN agencies and large international NGOs, but I was curious also what barriers you see from the donor governments to develop these types of relationships with the host country governments and the local NGOs to be able to bring that goal to fruition.
Thank you. I would say many, and not just the donors, but the national NGOs. So looking at national NGOs, particularly the really small national NGOs, one of the problems is going to be financial accountability. And the donors, the Western donors, have very stringent rules, and rightly so. But we've seen this consistently. Big NGOs, UN agencies have departments, hundreds of people to deal with this, to write the proposals, to do the reporting, to understand, make sure they have all the financial issues. And if you look at this, and again, I encourage you to look online with The Guardian, the UK, because they also have, there was a big thing just 2 months ago. So there's a lot of spin, and so it was cash-based interventions. The UK government in Somalia, and the big headline was that UK is paying for Somalis to be on the dole, the unemployment line, and it caused a big stink. And so there is rightly so that it's coming from taxpayers' money, and they want to make sure that they have that it's not being squandered. So there's by no means necessarily evidence that a national NGO will squander more money than an international NGO, but it's going to be extremely difficult for them to have these financial procedures in. Number two is that what's clear is they don't have the same salary scale. They don't always have the same technical capacities. When you come in, we always see this, the international agencies and the UN just hire the best and the brightest. And so that may also be a problem in terms of capacity. And I think a lot of people talk about trying to have the international and the national NGOs pair up. It hasn't really worked very well, I think, for a variety of reasons. But certainly in Haiti, it didn't work at all. And that was part of the goal. And we've spent billions of dollars here. So there's a lot of questions about that. And how it will actually work, and do we also have to accept, at least over time, so certain countries are clearly very strong, very, very capable. There are other countries that are not, and they don't even have much of a civil society, and there'll be questions about how to move this up. The other thing I just wanted to mention is certain groups, Doctors Without Borders, Médecins Sans Frontières, and others, do have some concerns about the humanitarian development nexus in conflict countries, whereas it's much easier to say in refugee settings we will be able to do this but in Syria, for example, with the Assad government, you're not going to be able to start. At least maybe Russia can, but the U.S. and the West is not going to suddenly say we're going to work in development with the Assad government at this point. So like everything else, it's going to be just like with cash and everything, it's going to be context specific, and we have to better elucidate when the factors are right to actually work on this, and when we say, and in the article I do try to say that when governments are not respecting humanitarian principles, when they're repressing the people that are in need, that's when the international community is going to still continue to have a strong response, not because of money, but because they have the autonomy to be able to speak out and deliver. But when governments, and probably it's going to be more in the refugee settings, because that's when it's unlikely, and it is in some settings, but in other settings, the host governments will not want to repress the refugees, but they will want a lot of help and more money coming their way. So with that, let me say that we will have another one in about October, I want to say 12th or 13th. It's coming up, and it's going to be Dr. Paul Weiss from Stanford University, and he's going to be talking about something that is extremely interesting, I believe, and that's why we've asked him to come, is he's going to be looking at just war and security and political issues and how they are affecting the humanitarian response in the future. And I was just with him in Mosul and Erbil, and it was really interesting to see how he looks at both the ethics and the just war and tries to use policies tries to use these theories to try to improve the various policies. So thank you for your attention, and look forward to seeing you next time.